Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate through February 9th, 2023. Today, I'm going to continue this series that we've been doing over the past couple of months and asking the question, what are the best steps we can take to live as healthy a life as possible? You recall that we've talked about cigarette smoking, overweight and obesity, sleep, exercise. And this week, I'm going to talk about perhaps a bit more controversial issue, and that is, what should I know about alcohol? Now, alcohol has a role to play in our social lives. It's obviously, there's aspects of the socialization that are perhaps beneficial, but what I really want to talk about today are the known health consequences of alcohol. And I think it's helpful to think of alcohol causing two types of health problems, short-term and long-term. Now, obviously, the short-term consequence that we think of the most relates to impaired driving, drunk driving, and so on. The numbers are pretty staggering. Over 11,600 deaths in 2020 from alcohol-impaired drivers, drunk drivers. That's 32 deaths a day, one every 45 minutes. That includes 200 children. Almost 1/3 of all traffic fatalities in the United States are caused by drinking and driving. And what's really worrisome is some of the numbers of the estimates, how many drunk drivers are on the road, are pretty staggering. One study estimated that over 18 million adults were admitted that they drove in the previous year, perhaps as many as 120 million times. So these numbers are pretty staggering. Now, drunk driving is not just a term of art. There is a legal definition. In all 50 states, it is illegal to drive with the blood alcohol above 0.08 or 0.05 in Utah. Some people have said that's one drink an hour. That's a little bit misleading, both on the high and the low end. There are some people for whom one drink an hour could be pretty problematic. On the other hand, there's some who could probably tolerate that. But remember, when people talk about a drink, and this surprises a lot of people, basically all of these drinks have about the same amount of alcohol. So a 12-ounce beer, a 5-ounce glass of wine, 1.5-ounce shot of distilled spirits. But it's also important to point out that even below 0.08, there's evidence of impairment with alcohol. So this chart, if you look at 0.05, for example, you still have reduced coordination, reduced ability to track moving objects, difficulty in steering. So it may not be a legal definition of drunk driving, but perhaps you shouldn't be driving at all at those levels. The most dangerous time of day to drive in terms of drunk driving is between midnight and 3 a.m. If you look here, you'll see that 2/3 of the fatal crashes between midnight and 3 a.m. involve drunk drivers. And that's also the greatest number of alcohol-impaired driving-related fatalities. About 2/3 of alcohol-impaired deaths occur Friday through Sunday, including DUI arrests, as you can see here. Independence Day week is the most dangerous time of year. And then many of the most dangerous days are when people are out celebrating, including, I would point out, the Super Bowl, which is happening this Sunday. And so please be very careful about drinking and driving. It's not just alcohol, traffic accidents, traffic deaths that reflect the short-term consequences of alcohol consumption. According to the National Institute of Alcohol Abuse and Alcoholism, alcohol is a factor in 30% of suicides, 40% of fatal burn injuries, 50% of drownings, fatal drownings, 50% of homicides, 2/3 of fatal falls, about 1/3 of all injuries treated at trauma centers, and a significant number of sexual assaults. And it has been reported that the majority of sexual assaults on college campuses involve alcohol or other substances. But it's not just sexual assault that poses a risk, because it's also high-risk sexual activity. And as according to NIAAA, again, alcohol influences individuals to engage in risky sexual activities because after consuming alcohol, people believe they have a lower inhibition and a higher level of confidence. So I can't find statistics on the number of sexually transmitted diseases or other consequences, but it's clearly a high-risk activity. This is not to ignore the long-term activities, the long-term consequences of alcohol consumption. Obviously, all of these, heart disease, stroke, and so on, but perhaps the one we think about the most is liver disease, fatty liver, cirrhosis, and so on. But there's also a number of cancers, a weakening of the immune system, learning problems, and so on. So it always raises the question, is any amount of alcohol safe? And interestingly, there are actually two different schools of thought here. One is that a small amount of alcohol is good for you, and the other is that no amount is good for you. The small amount is based on sort of two types of studies, if you will. One is called the French paradox, this idea that even though the French consume diets high in fat, they have relatively low levels of heart disease. And it's been postulated maybe about 30 years ago that this was due to red wine, and further postulated that it might be due to resveratrol, a polyphenol found in grapes and peanuts and other fruits and berries. And chances are, the odds look like the research is that resveratrol probably does have some health benefits, but not in the amount available in red wine. It's been said that to get enough to have a health benefit, you would probably have to drink yourself into a significant health problem. So the French paradox probably turns out to be an illusion, but as this article mentioned, it led to some interesting research that may have some benefits somewhere down the line. But if you've heard that drinking wine is a good thing for your health, chances are the data are not as strong as you would like it to be. The other type of argument that a small amount of alcohol is good for you is what they call the J-shaped curve. And here what you see is your relative risk of dying, total mortality, and about the amount of alcohol you drink per day. And you can see that people who, according to this, people who drink about half a glass a day, up to a glass, maybe two, actually have lower long-term mortality than those. Obviously, the more you drink, of course, it gets higher. But then the comparison group here is those who don't drink at all. And this is supported by a recent pretty large study out of Taiwan that looked at modest drinkers, that is, ones who have less than one drink a day. And they showed a benefit. Here, the modest drinker adds about a year to their life compared to someone who didn't drink at all. And if they're a smoker, 4 years. On the other hand, modest drinkers who smoke lose life. And of course, regular drinkers, those more than a day, have lower life expectancy. So all of those studies sort of led some people to believe that a small amount of alcohol is good for you. Unfortunately, as more data are gathered, it looks like that may not be the case. A rather comprehensive study out of the Netherlands, I believe, said that yes, these J-shaped associations are clearly there, and they're there, but that they believe that they may be not due to the amount of alcohol, but rather the underlying characteristics of people who are more likely to drink less alcohol. So people from higher socioeconomic classes who also have longer life expectancies anyway. And this is supported by a report out of Canada that just came out a few weeks ago that basically concluded that we now know that even a small amount of alcohol can be damaging to health. Research shows that no amount of alcohol is good for your health. It doesn't matter what kind of alcohol it is. And drinking alcohol, even in a small amount, is damaging to everyone, regardless of any characteristics. And they have this chart in there that shows the risk of complications. They do acknowledge that people who have 1 to 2 drinks a week likely avoid any alcohol-related consequences, but they also conclude that 3 to 6 drinks a week, which is well below the 1 drink a day that the Taiwanese study looked at, they do say your risk of developing several types of cancer would be higher. And then the more you drink, the greater it goes. So the odds look like that as more data are coming in, probably there is no absolutely safe or beneficial amount of alcohol. But again, some studies need to be done. Having said that, the CDC says there are some people who shouldn't drink at all, notably if you're pregnant or might get pregnant. Obviously, if you're under 21, if you have certain medical conditions, recovering from alcohol use disorder, and then I added driving or other vehicles. So the dietary guidelines for America that are current are a bit more liberal, and they're saying that they can choose not to drink or drink in moderation, which they say 2 drinks or less a day for men, 1 drink or less a day for women. But really the conclusion is drinking less is better for health than drinking more. So what steps can we take to live as healthy a life as possible? Well, obviously alcohol is important. If you're going to drink, drink in moderation. Definitely don't binge drink. Don't have these large amounts. And if you say, well, 1 drink a day is good, I'm going to have 7 drinks on Saturday. That's not the way that works. Don't drink and drive. Obviously, even a small amount of alcohol impairs your judgment, your ability to drive. Have a designated driver, that goes without saying. And be especially observant if you're driving in those high-risk times, midnight to 3 a.m., Fridays and Saturdays, especially around holidays and so on. But this last piece of advice I'm going to give you, perhaps, is the most important, and that's watch out for each other. You know, your heart breaks when you hear stories about a group of friends who are out at the bar and they leave one of their friends there because she met somebody who looks interesting or something like that. If people have been drinking, watch out for each other. Don't leave someone alone, and obviously watch out on the road as well. And if you feel that a friend, a loved one, or you yourself have a drinking problem, please seek professional help. Alcohol use disorder is a medical condition characterized by impaired ability to stop or control. I would make it real simple. If you feel that alcohol is causing someone interrupt their health or their social well-being, encourage them, or if it's you, encourage yourself to seek professional help. I'm not saying that there is no benefit to the social aspects of alcohol, but please understand that there are real physical consequences. So what are the best steps to take if we want to live as healthy a life as possible? Obviously, don't smoke. If you do smoke, quit. Achieve and maintain a healthy weight. Get enough sleep. Maintain an increasingly active lifestyle. And if you drink alcohol, do so in moderation. As always, please feel free to share this video with anyone who might be interested. All of our previous videos are cataloged on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. As always, I'd like to thank Derry Young for editing, producing, adding captions, and posting this video. And please let me know if you have any questions about what I've said this week or any other evolving public health issue. I really look forward to hearing from you. So until next week, please be well.